In this presentation, we will provide a brief overview of SARS-CoV-2 and COVID-19 and how it impacts veterinary clinics and clients. The content was created by Dr. Melissa Nelson, who is a practicing veterinarian and medical communicator with 20 years of both public and private veterinary medicine experience. And the course was compiled and is narrated by me, Dr. Emma Nichols, and I'm a medical writer with Nascent Medical. Thanks for joining the course. It was created obviously rapidly in response to an emerging situation. It was recorded in early April 2020. Please verify that any information, recommendations, and guidelines are accurate and applicable to your specific situation by going to the sources provided. The course is for informational purposes only and should not be construed as medical advice or guidance. Continuing education credits are not available for this course. The authors of this course have no financial relationships with any commercial entity. By the end of this course, you will be able to discuss COVID-19 and the danger to domestic animal species. You'll be able to describe modes of SARS-CoV-2 transmission in the veterinarian setting, and you'll be able to implement strategies for the delivery of veterinary services while practicing social distancing and minimizing risk to both yourself and your clients. COVID-19 is caused by a novel coronavirus, CoV, emerging in China in December 2019 and has caused a pandemic across the globe. The scientific name of the virus responsible for this disease has been designated by the International Committee on Taxonomy of Viruses as Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. The disease caused by SARS-CoV-2 has been designated as COVID-19. Symptoms range from an asymptomatic infection to mild respiratory symptoms to severe disease requiring hospitalization with intensive therapeutic intervention and as far as death. And also mortality is possible. The incubation period ranges from 2 to 14 days. Coronaviruses are a single-stranded RNA virus and known to affect both birds and mammals and cause respiratory and gastrointestinal infections. The coronaviruses belong to the subfamily Coronavirinae, which is the family Coronaviridae of the order Nidovirales. There are 4 known genera of coronaviruses. These are alpha coronaviruses, beta coronaviruses, gamma coronaviruses, and delta coronaviruses. Of these, only alpha coronavirus and beta coronavirus are an issue in humans and are derived from the bat gene pool. The coronavirus causing COVID-19, along with SARS and MERS, is a beta coronavirus. Until SARS emerged in 2002, the coronaviruses were generally considered to cause only minor infections, such as mild colds and respiratory illness in humans, with the exception of infants, young children, and the elderly. Veterinarians are well aware of coronaviruses as they cause illness in a wide range of mammals and birds. COVID can cause inapparent infection to mild to severe respiratory, enteric, or systemic disease in both mammals and birds. Felines are susceptible to feline enteric coronavirus, or FECV, which causes a subclinical to mild enteric disease in kittens, but mutations of FECV can lead directly to feline infectious peritonitis. Cattle and pig coronavirus infections can cause either respiratory or enteric disease, while dogs can develop a severe diarrheal disease from coronavirus infection and a respiratory illness. The canine respiratory coronavirus is genetically related to the bovine respiratory coronavirus and the human cold coronavirus, but not to the coronavirus that causes diarrhea in dogs. SARS, MERS, and COVID-19 viruses all appear to have their origin in bats, using an intermediate host before becoming a human pathogen. Severe acute respiratory syndrome, or SARS, appeared in Asia in November 2002, but there has been no known transmission since 2004. The Himalayan palm civet, or Paguma levata, is the intermediate host with palm civet meat, the likely point source. With Middle East respiratory syndrome, or MERS, dromedary camels are a major animal reservoir host and source of infection in humans. but the exact role in the viral transmission is not completely understood. A vaccine for camels has been developed which has helped limit the spread to humans. While the major route of transmission of SARS-CoV-2 is from human to human, the current evidence points to an animal source of the virus. While the search for the animal source is ongoing, genetic sequencing has determined that SARS-CoV-2 is a close relative to a coronavirus that circulates in the rhinolophus horseshoe bat. The intermediate host has also not been determined, but current evidence points to the pangolin. Pangolins are a heavily trafficked mammal in Asia and Africa, despite protection under national and international laws. The meat is considered a delicacy, and its scales are used in traditional medicine. And there is a picture of a pangolin. While the intermediate host has not yet been determined, we do know that so far in domestic animal species there have been no cases of COVID-19, and there is no reason to suspect that will change. The OIE, or the World Organization for Animal Health, has determined that if SARS-CoV-2 is detected in animals, it will meet criteria of a reportable disease through normal channels. There is also no reason to take any adverse action against wildlife species aside from the usual public health concerns. No evidence has been found to recommend the restriction of domestic animal movement at this time. Currently, there's no evidence that domestic animals can either acquire SARS-CoV-2 infection or transmit the virus to humans. Of interest is the case of a 17-year-old Pomeranian dog which was put in quarantine after its owner became sick with COVID-19. Testing by real-time PCR of nasal and oral swabs showed the dog had repeated weak positive responses for SARS-CoV-2. The test does not cross-react with dog or cat coronaviruses. On March 16, 2020, the dog passed away, but it had other health issues and the owner did not allow a necropsy to be performed. On March 19th, it was reported that a 2-year-old German Shepherd dog owned by a person who was positive for COVID-19 had tested positive on PCR. Neither the Pomeranian nor the German Shepherd dog, both of which tested positive, showed any symptoms of respiratory disease. All evidence points to pets or domestic livestock not becoming sick with COVID-19, but there remains the possibility they could be a fomite for SARS-CoV-2 from being in close proximity of a person shedding the virus. The definition of fomite is just an object or material which is likely to carry infection, and these can include clothes, utensils, and furniture, and also the fur and hair of domestic animals. The CDC recommends that people ill with COVID-19 refrain from direct care and contact with animals. If the animal is a service animal, or if other arrangements for care cannot be made, the following steps are recommended. Should wear a face mask, should not share food, hug, or kiss the animal, and not share dishes, glasses, cups, bedding, or towels with the animal, or allow them to sleep on the bed or in the same bedroom unless necessary, and also wash hands before and after contact with the animal. The primary means by which SARS-CoV-2 spreads is via close person-to-person transmission. Being near a person shedding the virus less than 6 feet in proximity and who coughs or sneezes is the main route of transmission. Droplet can either land in a person's nose or mouth or be inhaled into the lungs. The virus can remain airborne for up to 3 hours. Symptomatic people are the most likely to spread the virus, although asymptomatic people may possibly contribute to the spread. SARS-CoV-2 can survive up to 24 hours on cardboard, and animal fur is considered comparable to cardboard, and up to 3 days on stainless steel and plastic. Standard respiratory disease transmission procedures appear to work to help slow the spread of SARS-CoV-2 if they are diligently applied. Social distancing, by staying home if ill or in close contact with an infected person, and maintaining a 6-foot distance from healthy individuals is imperative at this time. Frequent sanitation of high-touch areas such as doorknobs, phones, computer keyboards, and countertops, etc., by virucidal agents is recommended. Limiting the numbers of people congregating is another means to slow the spread. Thorough hand washing for 20 seconds or more with warm water and soap will disrupt the virus lipid layer, rendering it inactive. Hand sanitizer use with 60% or higher alcohol concentration is also effective. For further in-depth information, please access the Compendium of Veterinary Standard Precautions for Zoonotic Disease Prevention in Veterinary Personnel, and the link is shown on the screen. Personal protective equipment consists of specialized clothing or equipment worn by an individual that creates a barrier between potential infectious or injurious materials and the wearer. Gloves, both sterile and non-sterile, are probably the most common used PPE in the veterinary clinic. Surgical gowns, obstetrical suits, and coveralls are also commonly used in veterinary practices. Surgical masks and respirators protect others from nasal or mouth secretions from the wearer and can also protect the wearer from external contaminants. Shoe covers and head covers are included in PPE. Eye protection, face shields, and goggles are also common PPE. While mandates vary by state and are updated daily, veterinarians are being increasingly asked to preserve PPE by canceling elective surgical procedures requiring the use of PPE, including routine spays and neuters. In addition, a few states have ordered veterinary clinics to inventory PPE, along with other clinical resources such as anesthetic machines and disinfectants, or to donate PPE for human healthcare needs. As such, veterinary clinics should investigate the use of cloth face masks, reusable gowns and head covers, and rescheduling or deferring surgeries. Cleaning involves completely removing visible debris and contamination. A surface needs to be thoroughly cleaned in order for disinfectants to work properly. Disinfection is the destruction of bacteria, viruses, and fungi on a surface depending on the organism and the type of disinfectant used. They are weakened in the presence of organic material. If done properly, cleaning and disinfection together make it unlikely for a surface to transmit infection and cause disease. Sterilization is accomplished by the use of chemicals, steam, and/or pressure to eliminate all pathogenic organisms on a surface. The use of autoclaves in veterinary practices are the most common means of sterilization in the veterinary hospital. The surface to be cleaned must first be properly inspected to identify contaminants and soils on the surface and to determine which disinfectant to use. All soils, such as dirt, fecal material, urine, blood, fur, hair, feathers, and dirty bedding, need to be removed by wiping, sweeping, scraping, and/or flushing with water and should be properly disposed of. This should be followed by rinsing with warm water of 105 to 115 degrees Fahrenheit until all visible soils are removed from the area. A detergent should be used to scrub the area, making certain to follow the manufacturer's instructions for dilution, and then the area should be rinsed with water. Disinfectants work best if the clean surface is allowed time to dry. Some products double as a cleaner, which is a detergent step, and disinfectant, and all require varying concentrations and dwell time to work against the target organism. Bleach, quaternary ammonium compounds, and accelerated hydrogen peroxide are a few examples of the many products that work well as disinfectants. Keep in mind that cats, birds, and small mammals may be more sensitive to certain disinfectants than dogs, livestock, and humans. Always thoroughly read product labels prior to use. Most common EPA-registered disinfectants are effective against SARS-CoV-2, along with a dilute bleach, which can be made by adding 1/3 cup of bleach per gallon of water or 4 teaspoons of bleach per quart of water. With rules and orders against congregating, veterinary clinics have been tasked with limiting the number of clients on premises. This can be accomplished by posting your clinic's policies via social media, emailing regular clients, and informing clients when they call for an appointment. Permanent signs posted at the clinic stores are also highly recommended. The veterinary clinic management should explore the safe serving of clients by providing telemedicine services, an outside triage area, and/or curbside service. Limiting how germs enter the veterinary clinic is the best means of protecting both clinic staff and clients. Should limit point of entry into the building with one entry for staff and another for clients. Have staff members monitor their own temperatures and stay home if sick. On a regular basis throughout the day, clean and disinfect common areas both in staff areas and client contact areas, including doorknobs, countertops, and areas clients have been in contact with. Visitors can be managed through screening questions. Do they have any respiratory symptoms? Has anyone in their family or immediate contact been diagnosed or suspected of having COVID-19? If they are sick or exposed, have a healthy person bring the animal to the clinic or postpone procedures. While a big source of revenue for most veterinary clinics is elective surgeries, wellness visits, and vaccinations, these will likely be halted either through government decree or because the local COVID-19 burden is very high. Veterinary management may need to explore a reduction in personnel and/or staff hours on a temporary basis. Utilize your state government unemployment benefits, as staff with reduced hours may be eligible for benefits and/or wait periods may be waived. Management should also investigate small business relief efforts which are becoming available as a result of this pandemic. Most states classify veterinary services as essential. Emergency and sick animal services will need to be provided as needed. Puppies and kittens will need their core vaccinations to be protected against life-threatening diseases. With spring coming to the northern tier states, ticks and mosquitoes will be making their comeback with a vengeance, along with the dangerous diseases they can spread to pets. Using curbside services and phone consultations with owners will minimize human-to-human contact while making sure pets are properly and timely vaccinated, and that heartworm, flea, and tick medications continue to be given at critical times. Euthanasia is a stressful time, even under the best of circumstances, for veterinarians, staff, and owners alike. Necessary social distancing measures compound this issue. There is no one right blanket decision for every clinic, but this should be addressed so expectations are clear for all staff members and clients. Pre-euthanasia sedation could be given at the client's car so the client can say a final goodbye. Staff would then ensure certain standard safety precautions are followed, such as the pet being muzzled or held by a staff member before the euthanasia solution is injected. One healthy member of the family, if they wish, could be present in the designated euthanasia room during the procedure. It is imperative that mobile and house call veterinary services practice social distancing and minimize risk. Should call clients prior to appointments to ask if there are any family members experiencing respiratory symptoms, and if they are self-isolating or quarantining, or if there are COVID-19 cases in their household. If so, reconsider attending the appointment or recommend referral to an emergency veterinary clinic if the appointment cannot be deferred. As social distancing is the means to reduce exposure of the veterinary staff, bringing a well-trained assistant to help restrain the animal will eliminate the need for close contact with the client. Springtime is a busy time on livestock and equine or horse farms. Calving and foaling season means large animal veterinarians are busy with farm calls. Maintaining social distancing on farms should not be a problem due to the good relationships most regular clients have with their veterinarians. However, in some instances, chute-side procedures like semen collection or vaccinations may need to be postponed due to both PPE issues and the close proximity of people needed to make sure these procedures can be done safely. Veterinary services at sales and livestock barns may also need to be sharply curtailed for similar reasons. Veterinary clinics are accustomed to having multiple deliveries and lab sample pickups throughout the day. Most companies are instituting their own procedures to reduce the risk of SARS-CoV-2 to their own personnel and the general public. You can check the company's website or ask delivery personnel what their protocols are and make certain they are aware of your clinic's protocols. Are deliveries only being accepted at a certain entry door, for example? Will the clinic allow deliveries inside the building, or are they to be left outside at a designated spot? And are lab samples to be left in a designated refrigerator, or will a staff member bring them to a pickup point? Telemedicine is another option to protect against the spread of COVID-19. Veterinarians will need to have a valid veterinarian-client-patient relationship, VCPR, to implement this practice. Some states have relaxed the typical one-year time frame for a VCPR to be valid, extending it to 18 months. If there is no prior established VCPR, any advice provided via telemedicine, much like when people call around to veterinary clinics seeking advice, should not include patient-specific recommendations. If staffing becomes an issue, telehealth services are available to help triage patients for the clinic. Here is a decision-making flowchart for veterinary telemedicine. Some of the considerations include whether you are allowed to diagnose or prescribe without an exam. Giving general advice is fine. Getting as much data as you can over phone, email, chat, or video. It's okay to stop short of a diagnosis and still provide valuable advice. And then ultimately, the decision maker is you. As is the case with a normal in-clinic visit, a telemedicine visit needs to include the same record-keeping elements. A thorough history needs to be taken along with the clinical signs reported by the client. A tentative diagnosis and treatment plan needs to be recorded along with medications prescribed, including amounts and frequency. Each state board will have their own requirements for veterinary telemedicine, so be sure to check with your state board prior to implementing telemedicine in your clinic. If your clinic hasn't already, it may be time to start up your clinic's online pharmacy. You'll want to check with your state board to ensure that you can dispense from your clinic if it is temporarily closed. If you're offering car-side service for pharmacy pickup, have the client call ahead to have the prescription and bill prepared prior to arrival at the clinic. If an opioid or controlled substance is being dispensed, make certain to ask for and check for a valid ID and take a photo ID for an extra layer of protection. As veterinary clinics are frequent targets for drug thefts, do not let down your guard on clinic security. Continue to implement your clinic safety plan as during normal business hours. We are all going through a trying time with shifting government rules and regulations, concern for our own and family members' physical and financial health, and the uncertainty that the future holds. Eat well, get enough sleep and exercise, and discuss concerns with family, friends, and colleagues. Hopefully, the information provided in this presentation will ease some concerns and give enough information to keep your clinic sustainable during these challenging times. Here is a list of useful resources, some of which we've mentioned during this presentation. We'll also put this in a PDF form in the resources section so you can directly click on the links. And then here is a listing of other courses available at our COVID-19 Resource Center. Just go to nascentmc.com, and in the top menu bar, there is a COVID-19 Resource Center that you can click on, and that will take you to these various courses. Some of them are currently free, and some of them are available on a pre-order. So please check those out if those are of interest. Thank you.